My name is Blanca Caicedo, and I would like to discuss the research article critique. The article that I chose is Family Caregiver of Palliative Cancer Patients at Home from the Journal of Palliative Care 26.3, Autumn 2010. The problem statement in this study. The clinical problem that leads to this study was to understand the process used by family caregivers to manage the pain of cancer patients at home. Puzzle of pain management. Understanding how the family caregivers assemble their puzzle pieces can help the healthcare professional make decisions related to the care plan they create for pain control and help them to recognize the importance of providing information as part of resolving the puzzle of pain management. The significance of this study, the researchers convey the significance of the study with the statistics that report that pain is experienced by the majority of cancer patients at the end of life. Worldwide review of cancer pain statistics reveal that half of the patients with cancer all stages reported pain. 70% of those with advanced stage of cancer. Patients with advanced cancer reported the highest frequency and intensity of pain compared to those with cancer at early stages. 20% to 30% experiencing severe pain. Pain can be controlled in 85 to 95 of people with cancer, but poor pain relief is well documented. Patients with advanced malignancy, 70 to 90% reported pain that is no relief at all. The purpose of this study was to understand that the process used by family caregivers to manage the pain of cancer patients at home. In this grounded theory study, they use an exploratory model titled The Puzzle of Pain Management, which includes four main processes: drawing on the past experience, strategizing a game plan, striving to respond to pain, and gauging the best fix. The questions identified in this method section were interview and field note. The data source were taped and transcribed. Data analysis was based on Stratus and Corbin 1998. Requirement for open access and selective coding. Qualitative methods were appropriate to answer the research question because they focus on the study was understand the process used by family caregivers to manage the pain of cancer patients at home. The perspectives of the participants were explored appropriately by allowing their experiences to be heard through a qualitative study. Leadership review. Reference of the article. The reference of this article were current. They may explain why the majority of the articles cited on this lecture review were published between 2000 and 2009, and just 12 out of 46 articles cited were published between 1989 and 1999. Disciplines used to develop the research. The author include different disciplines to develop the research: nurses and physicians of McGill University Teaching Hospital, nurses from the Victorian Order. Both of these identify eligible caregivers. Identify eligible caregivers were the ones as the most involved in patient care. Weakness or limitation of this study. Although valuable information was obtained about pain management process of family caregiver of cancer patients at home, the result of this study only reflect the experiences of a limited portion of this population. As a result, this qualitative study does not permit causal conclusions or generalizations. However, the author did feel confident that findings were significant and transferable to a large number of family caregivers managing the pain. Theoretical and methodological limitations. Data in this Qualitherapy study was collected through interview and field notes. They were recruited using purposeful and theoretical sampling. Data sources were taped and transcribed. Data management, analysis, and interpretation required clear procedures to ensure methodological rigor and credibility of the findings. The use of grounded theory by the researcher and sample size was not calculated prior to the beginning of the study, consistent, consistent with the grounding theory methodology. Frame of reference, data collection, sampling, and sample. Grounded theory method is one derived from the study of the phenomenon it represents and grounded in data collected. The focus of grounded theory is to understand the process of change from the perspective of the person who are changing. Grounded theory has become a research tradition used by nurse research. The method used in this study was interview and field notes taped and transcribed. Participants were recruited using purposeful and theoretical sampling. They were recruited by nurses and physicians. Family caregivers were eligible to participate if they were identified as a family member most involved with the management of pain at home, if they were caring for a patient receiving palliative care, or if they were able to communicate English or French. Sample size was not calculated at the beginning of the study, consistent with the grounded theory methodology. No rationale was provided for using interviews. Data collection method, however, is appropriate for qualitative study. Interviews were conducted by IM and all of them took place at the participant home except two done via speakerphone. Interviews usually last 45 to 60 minutes, and most participants were interviewed at two separate times approximately 2 weeks apart. The purpose of the second interview was to discuss the findings and give the participant time to reflect and clarify ethical and legal considerations related to protection of human subjects. Benefits of the research. An important benefit from the research was that family caregivers should feel ready before they engage in the process of gauging the best fit and joining the pulse of pieces of pain management. The study received ethics approval from the Ethics Review Board of organizations from which participants were recruited. Writing informed consent was obtained for all participants. Data management analysis and findings. Data analysis was reviewed as the data was collected and involved multiple reading of the transcripts, framework of open coding, axial coding, and selective coding. Comparative and memos were also used. The analysis was conducted primarily in the morning. Methodological rigor of the analysis was supported through consultation with the thesis supervisor and the thesis committee's member. They discussed the themes, categories, and primary findings. Findings of this study prove that healthcare professionals must ensure that family caregivers are prepared to manage their family members' pain at home in order to optimize pain control and prevent detrimental effects on the family caregiver themselves. Findings of this study were congruent with the study and purpose of this study was addressed by the research. Relationship between practice and research. This study reinforced the importance of the information sharing aspects of providing care. Health professionals or family caregivers that are struggling with the care of their family can assist with decision making, care provision, planning, and deliver according with that family unique need. Discussion of this study and nursing role. This study provides new information about pain management. The fact that family caregivers engage in several processes as they put together the individual puzzle pieces for management of pain is a critical finding. Accepting responsibilities were the sources of most of the variability between cases, and they also influence how caregivers gauge the best fit. Some caregivers implemented strategies for pain relief without feeling or being fully prepared. Unsuccessful or unsafe interventions are expected outcome of this, showing that the consequences of caregivers' unpreparedness is an inadequate pain management process. Research process was described in detail to conclude that the findings are credible and identify that healthcare professionals must ensure that family caregivers are prepared to manage their family members' pain at home in order to optimize pain control and prevent detrimental effects in families' caregivers themselves. Conclusion of this study. A strength of this study. Family caregivers were able to engage in several processes as they put together the individual puzzle of pain management. Family caregivers understand that they should feel ready before they engage in the process of pain management for their loved ones. Healthcare professionals understand how their actions can help family caregivers to be successful in managing the pain for their family members. They also understand the importance to work as a team together with family caregivers to achieve the best result. Evidence-based practice. Evidence-based practice is reflected on this study when family caregivers who had professional experience express more confidence than those who did not. They possess more information and felt prepared to manage pain. Establishing pain management relationship with the healthcare team was seen as an important process. This referred to the effort made by the family caregivers to develop or strengthen the relationship with doctors and nurses.